For the little delay, we had a little technical difficulties, so we will get started. Everyone can turn their cameras on, and we will get going. So welcome to the July 27th, 2022 board meeting. My name is Sung-Oh, President of the board. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Government Code Section 11133. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting. Before we get started, I would like to staff moderating the meeting to provide general instructions. Moderator?
Thank you, Mr. Board President. Before we get started, I would like to remind board members and senior staff who are not speaking to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief friendly reminder or simply mute microphones. To facilitate public comment, we will be using the WebEx question and answer feature. When the board president reaches a point in the agenda at which public comment is appropriate, public comment will be requested. At the board's direction, I will turn on and announce the opening of the Q&A feature. It is not necessary to identify yourself in order to make a public comment. Please note that the Q&A feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. Once given permission to unmute, the member of the public may unmute themselves and verbally state their comment. The Q&A feature is not to be used for typing out questions or for board members to communicate with one another. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism or negative views, for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. And with that, I return the floor back to you, Mr. President.
Thank you, Tricia. Before I take a roll call, I'd like to welcome Renee Barker, our newest member to the board. She's unfortunately not able to make it today, but Dr. Barker was appointed to the newly established compounding position consistent with the provisions contained in Assembly Bill 1533. Also, members, I intend to work with staff to develop a process for the board to resume its public recognition of pharmacists that have dedicated 40 years of service to the profession in the WebEx platform. We hope to roll this out as part of the September meeting. Thank you, and I would like to take a roll call to establish a quorum. Members, as I call your name, please remember to open your line before speaking. Maria Serpa?
Licensee member present.
Thank you, Maria. Jig Patel?
Licensee member present. Good morning.
Thank you, Jig. Good morning. Renee Barker is not joining today. Indira Cameron Banks?
Public member present.
Thank you, Indira. Good morning. Jesse Crowley?
Licensee member present.
Thank you, Jesse. Jose de la Paz?
Member of the public present.
Thank you, Jose. Kula Koenig? I believe Kula will be joining a little bit later today. Ricardo Sanchez?
Yeah, Ricardo Sanchez present.
Thank you. Thank you, Ricardo. Nicole Tebow?
Licensee member present.
Thank you, Nicole. Jason Wise?
Present, public member.
Thank you, Jason. And I am here, licensee members, so the quorum has been established. Members, we have a full agenda for our meeting over the next 2 days. I appreciate all of your time and commitment to the board and California consumers. I ask everyone participating today to be respectful of the work before the board today. We encourage participation by members of the public throughout our meetings at appropriate times. The board respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the board conducts its business. I will now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You're not required to identify yourself, but may do so. As we open the lines, I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following review of the public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the board and members of the public to request consideration of an item for future placement on an agenda, at which time the discussion may occur. Moderator, please open the line for public comment.
Thank you, Mr. Board President. I have opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. Just a reminder, you will have 3 minutes. I'll give you a 10-second warning. And our first request for comment is from Rajan Vaidya. So Rajan, you should be able to unmute yourself.
Good morning, members of the Board of Pharmacy. On behalf of the California Pharmacists Association, Rajan Vaidya, Vice President of Practice and Professional Development, we'd like to request an agendized item for the upcoming October 25th Standard of Care Ad Hoc Committee meeting regarding some updates and data around pharmacists providing care at the top of their license. We can follow up with an email request as well with additional information if needed.
Thank you for the comment.
All right, this is a moderator and I do not see any further requests for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia.
You're welcome.
Okay, members having received public comments, anyone have any comments? Just go ahead and raise your hand if you'd like to say anything. Go ahead, Jesse.
Sorry, just maybe I didn't hear correctly. So it was the public comment to see if we can add an additional agenda item to the standard of care meeting with new data that was presented?
Yeah, I believe that's correct. I'm going to defer to Anne, but I believe we are trying to figure that out sometime today, actually. So.
I mean, I personally would invite any more information that we can for that meeting. So I would be open to making a motion to considering that information or helping and figure out if it's appropriate to add that to the agenda. I don't know really what that motion would look like. Sorry if that was a lot.
Yeah, the motion's not necessary, Jesse. Yeah. Okay. I don't, as far as I know. Yeah. Eileen, if you want, yeah, just confirm.
No, I agree with President O. A motion isn't necessary, and I think it can be deferred to Ann and Sung when they, President O, when they develop the agenda with your comments note.
Okay. Anyone else have any thoughts? Okay, we're going to move right along to the next agenda item 3, approval of board meeting minutes. Included in the meeting materials are draft minutes from the April 26 through 27, 2022, May 11th, 2022, and June 16th, 2022 board meetings. As we begin, I will first ask for questions or comments on the draft minutes from the April 26 through 27, 2022 meeting. When you speak, please remember to identify yourself prior to making comments. I will also entertain a motion to approve the minutes, starting with the April 26, 27, 2022. If anyone have any comments or willing to make a motion.
Mr. President, this is Jason. I'll make the motion.
Thank you, Jason. Jason motions. Anyone second Jason's motion?
This is Nicole. Can I ask a technical question?
Of course.
Sure. If we were not present, should we abstain from voting on these?
I will defer that to our counsel, Eileen.
Hi, this is Eileen Smiley, and no, even if you weren't at the meeting, it's perfectly permissible for you to vote on the minutes as well. But so you're not required to abstain. It's up to you.
Okay, then I will second the motion to approve the minutes.
Thank you. Thank you, Nicole. With the motion and second by Jason and second by Nicole, we'll open up any other member comments. Hearing none, we will go for public comment.
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We're displaying instructions and we'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Thank you. With a motion and second and no public comment, I'll take a roll call vote. As a reminder, please unmute before voting, starting with Maria Serpa.
Yes.
Maria, yes, right? Sorry, just was.
I'm sorry, did you not hear me? Yes.
Yes, okay, perfect. Jake Patel?
Yes.
Thank you, Jake. Jake votes yes. Indira Cameron Banks?
Yes.
Thank you, Indira. Jesse Crowley?
Yes.
Thank you, Jesse. Jose De La Paz?
Yes.
Thank you, Jose. Kula Koenig is not here. Ricardo Sanchez?
Yes.
Thank you, Ricardo. Nicole Tebow?
Yes.
Thank you, Nicole. Jason Wise?
Yes.
Thank you, Jason. And I vote yes, the motion passes. So the next draft minutes for our consideration are from May 11th, 2022 meeting. When you speak, please remember to identify yourself prior to making your comments. I will also entertain a motion to approve the minutes. Members?
I'd like to make a motion to approve the minutes.
Thank you, Jake. Jake makes the motion to approve the minutes for May 11th, 2022 draft minutes. Anyone second?
I'll second that. This is Ricardo Sanchez.
Thank you, Ricardo. Ricardo seconds the motion and second, and we'll open up for public comment. Tricia?
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia. With a motion and second and public comment, we're going to take a roll call vote. Maria, how do you vote?
Yes.
Okay, Maria votes yes. Jake Patel, how do you vote?
Yes.
Thank you, Jake. Indira, how do you vote?
Yes.
Thank you, Indira. Jesse, how do you vote?
Yes.
Thank you, Jesse. Jose De La Paz, how do you vote?
Yes.
Thank you, Jose. Ricardo, how do you vote?
Yes.
Thank you, Ricardo. Nicole, how do you vote?
Yes.
Thank you, Nicole. Jason, how do you vote?
Yes.
Thank you, Jason. And I vote yes, the motion passes. The next minutes are for consideration from June 16th, 2022 meeting. So anyone willing to make a motion?
I'll make a motion to approve June 16, 2022 board meeting minutes.
Thank you. Thank you, Jake. Jake motions. Anyone seconds Jake's motion?
This is Jesse. I'll second.
Oh, I think Jesse and Jason spoke at the same time. I will go with just Jesse since Jason already seconded. So Jesse seconds Jake's motion to approve the minutes. Any other comments? Okay, with that, we'll open up for public comment.
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and send it to all panelists, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia.
Welcome.
With a motion and second and public comment, we'll take a roll call vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jake, how do you vote?
Yes.
Thank you, Jake. Indira, how do you vote?
Yes.
Thank you, Indira. Jesse, how do you vote?
Yes.
Thank you, Jesse. Jose, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you, Ricardo. Nicole, how do you vote?
Yes.
Thank you, Nicole. Jason, how do you vote?
Yes.
Thank you, Jason, and I vote yes, the motion passes. Moving right along to agenda item 4, update from the Department of Consumer Affairs. I'd like to welcome Mary Kate Cruz-Jones with DCA Board and Bureau Relations to provide an update from the department. Ms. Cruz-Jones, are you ready?
I am. Can you hear me?
Okay, perfect. We can. The floor is yours.
Perfect. Thank you so much. Good morning, and thank you for allowing me an opportunity to provide the Department of Consumer Affairs update today. My name is Mary Kate Cruz-Jones, and I am providing the update on behalf of the Executive Office. The Governor signed Senate Bill 189 on June 30th, 2022, which reinstitutes through July 1, 2023, the remote meeting provisions of the Bagley-Keene Open Meeting Act that were in place during the pandemic. The changes took effect immediately.
I'm sorry, this is the moderator. That was my bad. I didn't realize that promoting her would unmute her. Mary Kate, forgive me. Please unmute yourself.
Okay, can you hear me now?
Yes.
Beautiful. Okay, I'll take it from the top. With no objections, I'll start again. Good morning, and thank you for allowing me an opportunity to provide the Department of Consumer Affairs update today. My name is Mary Kate Cruz-Jones, and I'm providing this update on behalf of the Executive Office. The Governor signed Senate Bill 189 on June 30th, 2022, which reinstitutes through July 1, 2023, the remote meeting provisions of the Bagley-Keene Open Meeting Act that were in place during the pandemic. The changes took effect immediately upon signing. Please be aware that DCA wants you to have the right meeting for the business of the board or bureau while still taking into consideration both costs and public participation. We are asking boards to still track the costs for meetings, even those that there isn't travel involved, and also to use WebEx as much as possible to allow the public to attend remotely, especially as COVID-19 numbers continue to rise. DCA is still asking boards to complete the public meeting survey to assist in tracking these costs for your board meetings in order to be able to compare costs for in-person and WebEx meetings, since the legislative change is only in place for this fiscal year. We have distributed the surveys to all boards and bureaus and ask that they can be completed within the next 30 days after each meeting held. Should you have any questions, please feel free to reach out to DCA. Though legislation has passed allowing remote meetings, we are reminding boards that choose to hold in-person meetings of safety measures, best practices, and recommendations for holding public meetings. When planning for upcoming meetings, please remember, all board and bureau members and staff are expected to follow the state and local public health guidelines that apply in the area where the meetings are held. Face coverings are strongly recommended for all board members and staff at meetings. The California Department of Public Health strongly recommends that individuals continue to mask in indoor settings. Please post face covering guidance signage at your meeting check-in or entrance. And regarding vaccination and testing, prior to meeting in person or at a remote location, members need to submit vaccination verification to DCA's Office of Human Resources or be subject to COVID-19 testing. We are pleased to announce the inaugural report of the Enlightened licensing project is now available and was distributed to all boards and bureaus on Friday, May 13th. This innovative and collaborative project was started to streamline and enhance licensing processes by utilizing the knowledge and expertise of subject matter experts within DCA's boards and bureaus. The project was conducted in partnership with the Board of Registered Nursing. After a thorough assessment of some of BRN's licensing processes, the project's co-chairs provided recommendations to introduce new ideas and implement best practices for critical licensing activities. DCA held a brown bag event on June 1st to review the recommendations with all boards and bureaus, as we hope that other boards and bureaus can learn from this report and implement recommendations where applicable. We believe it is so important to learn from each other and share our knowledge. We will be turning to enforcement next, and we will be reviewing the enforcement process at a board through this enlightenment process, utilizing enforcement subject matter experts. DCA also recently held a brown bag meeting with executive officers and bureau chiefs on July 5th, 2022, to roll out changes to DCA's regulation development and approval process. These changes were also discussed and approved by DCA's Executive Officer Cabinet. DCA shared documentation on the process and changes with all boards and bureaus. And we hope that this is very effective and we're excited about these new changes. DCA is pleased to announce that Nicole Lay was hired on June 24th as the Deputy Director of DCA's Office of Administrative Services. With more than 20 years of state experience, Nicole has dedicated 10 of those years to DCA. Most recently, she served as the Acting Deputy Director of OAS, where she was responsible for overseeing the business functions of Human Resources, Fiscal Operations, and the Business Services Office. Prior to this role, Nicole was Chief of DCA's Office of Human Resources, and she had previously served at the Contractors State Licensing Board and the Department of Motor Vehicles. We are very excited to have her as part of DCA's executive leadership team. It is with great sadness that we announce that there were some transitions within our executive office. Carrie Holmes, who was the Deputy Director of Board and Bureau Relations, left DCA on May 13th, and Brianna Miller has accepted another position, and she left DCA on June 10th. DCA appreciates the support and service that Brianna and Carrie have provided our boards and bureaus. They both were a huge asset to the department. I'd like to assure you that during this transitional period with BBR, the DCA Executive Office would like to have no changes in the continuity of services that we offer to you all. If you need anything, please feel free to contact DCA Member Relations or feel free to call the executive or email the executive office directly. We are here to serve you and we want you to feel that support. The department was recently advised by the State Controller's Office that there will be a delay in processing and approving travel expense claims until the end of July due to them setting up the new year fiscal budget in the Fiscal system. We appreciate your patience, and claims will be processed as quickly as possible once they are able to use the system again. And lastly, board members are required to complete BMOT within 1 year of appointment or reappointment. The final training of 2022 will be offered on October 12th. Members can register through DCA's learning management system. BMOT is required for newly appointed and reappointed members, but please, if anybody else would like to join us, feel free to. It's a great refresher for any member or executive officer. If you have any questions about this, please feel free to, again, reach out to us over at DCA. As always, DCA is here to help, and if there's anything that we can do to assist you, please feel free to let us know. And that concludes my update, so I will pass it back over to your president. Thank you so much.
Thank you so much, Ms. Jones. Any members, do you have any questions or comments for Ms. Cruz-Jones? Not hearing anything, so we'll open for public comment.
Thank you, Mr. Board President. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists, or you may simply raise your hand. We are displaying instructions and we'll give you a moment. And we do have a request for comment from Daniel Robinson. So Daniel, You should be able to unmute yourself. And Daniel, you're unmuted.
Thank you. Are you hearing me?
Yes.
Yeah, thank you. During a spring board meeting, we had a conversation about the MPJE as a potential replacement for the California Pharmacy Jurisprudence exam. And there was a report that was given by OPES that found that the data wasn't quite sufficient in order to endorse that change. Since then, I know that National Association of Boards of Pharmacy has reached out to OPES and the Department of Consumer Affairs willing to provide additional information that would be requested, and they're currently waiting for information from the Department of Consumer Affairs about what additional information would be useful to them in their analysis. So I'm afraid that it's sort of languishing because there's no communication going on between NABP and either OPES or the Department of Consumer Affairs. And I just want to raise that as an issue and maybe open up those lines of communication if possible. Thank you.
All right, and that marks the end of requests for public comment. Shall I close the Q&A panel?
Yes, please. Thank you so much. Thanks for coming to the meeting, Ms. Cruz-Jones. Appreciate your time and providing us with an update. Next agenda item is agenda item 5, discussion and consideration of board strategic plan. As you may recall, the board strategic planning session occurred as part of the board's September 2021 meeting. Following adoption of the new plan, on an annual basis, the board review its strategic plan to confirm the established strategic objectives for each committee remain appropriate or if changes should be considered. This annual review also serves as an opportunity for the board to evaluate progress in the respective areas. As a precursor to our review today, with the exception of the Organizational Development Committee, the committee completed a review in their respective goal areas. I will ask the chairs from the respective committees to provide a board with an update on its discussion. I note from the meeting materials that no committees appear to be offering recommendations to change any of their respective objectives. As such, from a process standpoint, public comment will be taken at the end of the board's full discussion. As the chair of the licensing committee, on behalf of our members, we are pleased to report the status of the various objectives established for our committee. You'll note that the efforts are underway for many of the objectives. I believe some of these objectives will be multi-year activities, and I look forward to the continued momentum in several of the objectives already underway. Do we have any members have questions or comments on the licensing committee's strategic objectives? Okay, no one is unmuting or raising hands, so we'll move on to I'll turn over the meeting to Maria Serpa, Chairperson of the Enforcement and Compounding Committee. Maria?
Thank you, Mr. President. Members, during our meeting last week, the committee reviewed the strategic objectives from our committee. As a committee, we believe the established strategic objectives are appropriate and we are not recommending any changes. As I shared during last week's meeting, I anticipate the coming year there will be significant activity related to the strategic objective 2.10 as USP completes its work to revise and release chapters related to compounding. Unless you have any questions or comments to our strategic objectives and the status updated, I'll turn the meeting back to the president.
Thank you, Maria.
Thank you.
Now, Jesse, I turn the meeting over to you to provide an update from the Legislation and Regulation Committee. Jesse?
Good morning, members. As part of our committee meeting last week, our committee reviewed the current strategic objectives and the status of efforts undertaken during the last fiscal year. The committee is not offering any changes as we believe the current strategic objectives are still appropriate. Several of the objectives will be ongoing as the board of the committee and board will continue to monitor and respond to legislation, for example. Members, do you have any questions on the Legislation and Regulation Committee strategic objectives? If not, I will turn it back to President O.
Thank you, Jesse. Ricardo, we are ready for the update on the strategic objectives from the Communication and Public Education Committee. Chair Sanchez?
Yes, recap. This is a discussion of the board's strategic plan agenda, item 5. Anyways, the Communication and Public Education Committee made no changes to the communication and public education goals of the plan. Members agreed that the objectives at this time are in line with the overall strategic plan. Also, the committee can always revisit any of the goals if needed. There was some discussion regarding goal 4.7, which is improved communication to licensees by personalizing it and decreasing verbiage to encourage licensee engagement. It was suggested that the board send out recall notices as a single daily summary rather than sending an alert for each notice, as a way to avoid overwhelming licensees with too many emails, especially at 5 p.m. on Fridays. Staff agreed to review how to recall notices are issued and possibly set the matter for discussion at a future committee meeting. That's basically it.
Thank you, Ricardo. Appreciate it. And thank you all the chairs and all the members of each committee. The last report is strategic objectives that fall under the purview of the Organization Development Committee. This committee is comprised of the board president, vice president, and executive officer. As this committee does not meet in public, you'll note that it is not offering any recommendations. The meeting materials detail out the various strategic objectives and status updates are provided. I would like to specifically mention Objective 5.2 related to a formal onboarding program for new board members. As we have several members that have recently joined the board, I'd like to request that if you have any recommendations on ways to improve upon the initial orientation and or process that you believe would assist future members, please email Ann Sodegren. We are a very complex board and want to ensure we are providing members with helpful information and follow-up. Maria, before I open the discussion to other members, do you have any comments to add?
Thank you, Mr. President. I have nothing to add.
Thank you. Thank you, Maria. And do you have any questions or comments on the strategic objectives for the Organizational Development Committee for members? Hearing none, we're ready for public comment. Tricia, please open the line for public comments.
Thank you, Mr. Board President. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. Or you may simply raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
Okay, we're ready to move on to agenda item 6, Organizational Development Committee report. I'll now provide an update on several items under the purview of the Organizational Development Committee. You will note from the meeting materials, there is one potential item for action. So starting with budget update for fiscal year 22 through 23, the new fiscal year began July 1st of 2022. The board spending authorization for the new fiscal year is about $31.3 million, which is an 11% increase from the prior year. Budget update for fiscal year 21 through 22, as indicated in the meeting materials, the final budget figures for fiscal year 21 through 22 will not be available until later this year. The meeting materials include preliminary figures through May of 2022. The board received about $34.8 million in revenue. The largest source of revenue comes from licensing fees. The board expended about $26.7 million, with the largest expenditure being personnel, followed by pro rata and enforcement. A review of the fund condition prepared by the department indicates that at the end of the fiscal year 21-22, it is projected the board will have 4.8 months in reserve. As indicated in the meeting materials, under provisions of pharmacy law, the board shall seek to maintain a reserve equal to approximately 1 year's operating expenditures. Further, the fund condition projects a continued depletion of the board's fund. The fee analysis is currently underway, and we anticipate the results will be available for our consideration as part of the October 2022 meeting. Any questions on the board budget report for members? Please raise your hand or, okay. Moderator, please open the line for public comment on the budget information just reviewed.
Thank you, Mr. Board President. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We will give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you. Next item is board member attendance and mail board information. Attendance is summarized in attachment 2. Further, attachment 3 includes mail board information. Any comments from members? All right, moderator, please open the line for public comment.
Thank you, Mr. Board President. I'm opening up the Q&A panel. Again, if any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you. And next is personnel update. As detailed in the meeting materials, the board has a number of vacancies, including a key leadership position. The vacancy count is higher as the board received new positions on July 1. It is my understanding several of the inspector and licensing positions have active recruitments underway. I look forward to monitoring the progress of these recruitments, as filling vacancies will help reduce processing times. I'm working closely with Anne on recruitment challenges. Members, do you have any questions or comments on the personnel update? Hearing none, moderator, please open the line for public comment on the personnel update.
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you.
Okay.
And the next item and the last for organizational development is discussion and consideration of board policy related to legislative positions. The board member procedure manual includes, among other items, delegation of various activities to identified roles within the board. Related to our discussion today is the board's policy related to taking legislative positions on emergent bills between board meetings. I believe the delegated authority established in the policy is essential, as legislation can move at a quick pace and may not align with board meetings. I am in support of continuing the delegation process. Having the opportunity to serve as the president and chair of the Legislation and Regulation Committee, I can honestly state that during the legislative season, I have been in routine contact with Anne, monitoring changes to legislation and authorizing actions consistent with the board's policy. To ensure compliance with provisions of the Open Meetings Act, it is necessary for the board to update its policy to delegate this function to a single member. As you may recall, for a number of years, the board president and chair of the Legislation and Regulation Committee has been the same person. I would appreciate your comments on this issue. I note that there is a possible motion included in the meeting materials. You'll note that the motion provides the general construct for the motion, but will require clarification of which position within the board should be granted such delegation. Suggest either the president or chair of the Legislation and Regulation Committee. I personally feel okay with either direction, depending on whether members feel is the right way to go. So members, any thoughts?
Hi, this is Maria Serpa.
Hi, Maria.
I am in favor of the concept and having the delegated power to go to the board president, because oftentimes there are more global issues to consider as we consider our positions on legislative issues. The chair of the committee may not be aware of all of the other outstanding issues, although I'm sure the staff and Ann would inform them. So I would move that we delegate the power to the board president, and as stated in the projected slide.
Thank you, Maria. Thank you. Thank you for the motion.
I'll second
Anyone? Thank you, Jig. Jig seconds. Okay. Any other member comments before we open up for public comment?
Ms. Jose, sorry, go ahead.
Go ahead, Jose.
Go ahead.
No, I was just going to say that I was leaning originally towards, the chair, but, after hearing the a different perspective, I think that makes sense given, all the other potential pieces to a puzzle. But, I would like, still, I think the chair should be, an active participant in the entire process. And a strong voice on any potential amendments or other negotiations that need to occur. So I don't know if there's a hybrid approach that could occur there, or it has to be one or the other. Just a general question, and I'll hand it back to the rest of my colleagues. Thank you.
Hi, this is Eileen. And I just wanted to say, we usually have it to one person to avoid any problem. If you have two, it can be viewed as a quorum of a committee, and it could end up with problems under the Open Meetings Act, particularly for substantive. So just for an abundance of caution, I don't see a hybrid approach here. I think it's to one or the other. And then, of course, they always report back to the board at the next meeting as well.
And that's the hybrid approach. That's because the president is part of the committee. But if the president wasn't part of the committee, then that potential conflict wouldn't be there. Is that correct?
No, it would still be there, because if you ever have two members of the board talking with each other, it could be viewed as even not an unnamed committee, but just a committee. It's just we usually try and keep, as you know, if we're talking to one board member, it's only one, to avoid any type of problems with sequential meetings or anything like that. So it's generally one person or the other.
But two could be speaking to each other. It says that, avoiding that chain meeting, right, for occurring between more than two, or
that's correct.
I think, yeah. Okay, yeah, I mean, that was just my thoughts. So I'm open to hearing what my colleagues have.
Thank you, Jose. I do totally agree with you actually on the, I hope there is a way for us to figure out a way to make it a little bit more hybrid. The decision maker may be the person, but I think that there should be a way for us to have some communication to inform the chair of the legislative committee. Nicole, go ahead.
Yes, I was just going to say, though, President O, you do a wonderful job. There are a lot of decisions that fall to you. So, and with an equity lens here and bringing alternate perspectives, I think having it be the chair might be beneficial if we truly have to choose one. I agree with the hybrid, but if it really is one, I think having it the chair kind of spreads some of that power dynamic a little better.
Thank you. Thank you, Nicole. Jason?
Hi, yes, Sung. I really do like the perspective of having the board president be in charge, having, like Maria said, that more global perspective. When legislation is approved or reviewed at the committee level, it does go before the full board to get their input. So with that being the case, that the board chair is the head of the pharmacy board, I like that it be the president. What I would like to see is, if possible, on the back end, once we're dealing with emergency legislation, things that have an urgent issue to them, if there is an opportunity for the committee to review and step in either affirm the president's position, that would be great. So if that's possible, if we could fashion that somehow, I think that would be good.
Thank you, Jason. Jesse?
Thank you. I agree with Nicole's comment. I would lean more towards the chair of the committee being the one who's delegated power, but I agree with Jason's last comment in that, of course, in emergency situations, it's really difficult to get everyone's input, but when possible, if there's a way to get input from the rest of the committee, I think that would be beneficial.
Absolutely. And Maria?
Thank you. I'm sorry. I just wanted to add one more thing after listening to everyone's comments to, I think in the background material, and just to remind everyone is in between meetings, the president is constantly working on legislation with amendments and with the author's office and with the staff. So the president already has this role with existing and ongoing legislation. So just wanted to throw that out there that that's something that was already happening in that limited space.
Thank you. Go ahead, Jesse.
I have a question, I guess, and maybe this is more for staff, but would it make sense moving forward if the chair of the legislation committee is the one working with Anne on, updated legislation throughout the year? I know it's a lot and there's always 1,000 things coming through, but would it make sense to delegate that to the chairperson?
I'm not trying to dodge the question, but I think it's really a decision for the board. It's more about a policy issue than a practical. Board staff are happy to work with whomever. We just want to make sure that we are following the policy of the board, and so that's why it's been brought forward for your consideration.
Great, thank you, Anne.
Any other comments before?
I think I'll be, if I had to go with one or the other, I think if a hybrid approach wasn't, possible, I think, I would be leaning towards Nicole and Jesse and my thoughts.
Okay. All right. Maria made a motion. So anyone wants to second Maria's motion? Oh, Dijik did. Okay, perfect. So let's try to go for public comment, and then we'll go for the vote and see where it lands.
All right, Sean, can you remind us what Maria's motion is?
Oh, it's to delegate the power to the board president to take board positions on emergent bills between board meetings. What's displayed on the slide as with the board president being inserted.
Great, thank you.
All right, this is the moderator. I have opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We're displaying instructions and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you. So we'll call for the vote. Maria, how do you vote?
Yes.
Yes, thank you, Maria. Jake, how do you vote?
Yes.
Oh, thank you, Jake. Indira, how do you vote?
Yes.
Thank you, Indira. Jesse, how do you vote?
No.
Thank you, Jesse. Jose, how do you vote?
No.
Thank you, Jose. Ricardo, how do you vote?
Yes.
Thank you, Ricardo. Nicole, how do you vote?
No.
Thank you, Nicole. Jason, how do you vote?
Yes.
Thank you, Jason. And I'll vote yes. So the motion passes. But just, I believe there is an opportunity I will work with the council to see if there's more ways to include, and it's just Open Meetings Act is a very complicated law. So I always say this every time. I'm not a lawyer, so it's just hard to navigate, but we will definitely try our best to figure out a way to make this more of a hybrid approach going forward. And I think what we've been doing has been working well. So we'll keep you all informed of what's to come. And so with that, we're moving on to the next agenda item is future meeting dates, which attachment 4 includes the meeting calendar for the remainder of 2022 as well as 23. Thank you again to everyone for your continued commitment to the board. And members, any comments? All right, with that, we're going to go for public comments.
Thank you, Mr. Board President. I'm opening up the Q&A panel. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia. All right, next item is agenda item 7, Standard of Care Ad Hoc Committee Report. And also just let me know if anyone would like a break, just raise your hand and we'll take a quick break, but I think we're gonna go on for now. Moving on to agenda item 7, Standard of Care Ad Hoc Committee Report. I'm happy to provide a report on behalf of the Standard of Care Ad Hoc Committee. I'd like to thank my fellow committee members, which include Maria Serpa, who is serving as Vice Chairperson, Indira Cameron Banks, Jessica Crawley, and Nicole Tebow. As you may recall, as part of the provisions of Assembly Bill 1533, the board was required to convene a work group of interested stakeholders to discuss whether moving to a standard of care enforcement model would be feasible and appropriate for the regulation of pharmacy and make a recommendation to the legislature about the outcome of these discussions through a report submitted to the legislature. The report is due on or before July 1st of 2023. So starting with summary presentation provided by Carrie Webb, as part of our meeting on June 22nd and continuing our education on the issue, the board received a presentation by Carrie Webb, a counsel for the Medical Board of California. The presentation was very informative and highlighted the positives and negatives for a standard of care model and challenges with such a model. The meeting materials summarize the presentation, member comments, and public comments. The presentation slides are included in attachment 1. The June 22nd meeting was webcasted and is available on our website if members would like to watch the presentation. Members, do you have any questions or comments on the presentation? Hearing none, moderator, please open the line for public comment.
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We'll give you a moment. All right, we do have a request for comment from Daniel Robinson. Daniel, you should be able to unmute yourself.
Thank you. I just have to say that I think Ms. Webb provided an excellent presentation. It was very informative, and I think it helped us all. When Chairperson O started the meeting, he did ask Ms. Webb to stay online so she could answer or respond to any questions from the board or the public. And unfortunately, when it came to public comments, there were several questions that she was not given the opportunity to answer. And one in particular, I believe is very important because it has to do with the standard of care based on region. So there was a question about, if someone lives in Barstow versus Santa Monica, should they expect a different standard of care? And that locality-based thinking could be overwhelming for the board if you actually think that it depends where you live, that the standard of care would be different. But the truth is, standard of care is the highest level of service you can provide, and pharmacists would only be providing services that they're qualified to provide. And in fact, in many urban areas, many rural areas, the amount of care provided by community pharmacists is actually a much broader scope than what you might find in rural settings where there are much more access to healthcare services. So I just wanted to comment on that and clarify it. And I was sorry that Ms. Webb was not able to respond to those questions. Thank you.
All right.
Thank you for the comments.
And I see no further requests for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia.
You're welcome.
Okay, next item is summary of discussion and actions taken by other state boards of pharmacy related to standard of care. Also, as part of our meeting, we reviewed the actions undertaken by Idaho and Washington State Boards of Pharmacy as included in the meeting materials. Provisions of the law in the respective jurisdictions was provided, as well as educational materials. I'm hopeful members had an opportunity to review the materials. You will note that materials highlight where there are similarities and differences with California law and the other jurisdictions related to pharmacists' authority to provide patient care services. The information was provided as additional education for the committee members and interested stakeholders. Members, do you have any questions or comments? Moderator, please open the line for public comment.
Thank you, Mr. Board President. I'm opening up the Q&A panel. And if the public would like to make comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you.
Welcome.
Okay, next item is discussion and consideration of policy questions related to standard of care in the practice of pharmacy. Following the presentation and consideration of the efforts undertaken by Idaho and Washington, the committee began consideration of various policy questions intended to assist members and interested stakeholders in assessment of the large policy question before the board. Should the board transition to a standard of care enforcement model? This issue is a very complex one. As detailed in the meeting materials, the committee has not reached a conclusion or consensus. While the issue on its face may seem to be a simple one, the more discussion and consideration of the issue seems to raise more questions about the possibility and possible impact of a transition to a standard of care enforcement model rather than leading to a conclusion. The meeting materials summarize the committee's discussion on the various questions and public comments received, so I will not review in great detail. However, I will highlight a few key takeaways. Members are seeking additional data, including data that supports that a standard of care model results in improved patient care, information on the board's enforcement timeframes, and data on ownership of pharmacies in California. Although it is appropriate to learn about how other agencies may use a standard of care enforcement model, it is important to note that there are differences in the scope of regulation, demographics, and other factors unique to the board that must be contemplated, and ultimately, what is the impact to California consumers. Although the question of whether a transition to a standard of care model remains outstanding, there does appear to be general agreement from many stakeholders that it may not be appropriate for such a model to be used for all areas of practice. As a committee, we are also unclear if a standard of care enforcement model is possible, and the concept of the expanded scope of practice versus standard of care enforcement model needs to be more thoroughly contemplated. Further, we must remain mindful to ensure whatever the outcome is, it does not result in healthcare inequities. Members, do you have any questions or comments any questions or comments on this section? I'm seeing none here, so we're going to move along to public comment.
All right, I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. Or you may simply raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
The committee will continue its evaluation of the issue at its next meeting. It is a complex issue, so I hope you all can continue to keep up with the committee's work and hopefully be able to watch the webcast or in some fashions to continue to monitor the discussion. Next agenda item is agenda item 8, Medication Error Reduction and Workforce Ad Hoc Committee. And before I turn the meeting over, just want to confirm and survey if any members need any break.
Yeah, could we take a 5-minute break, Sung?
Sure, we'll take a, Jose, you raise a hand? Just
No, I was going to say,
break?
yes, I need one. So I was
okay, sounds good. We'll take a 10-minute break. We'll come back at 10:15.
Okay, perfect.
Is everyone back? We'll take a roll call. I know we have always things going on, so if you leave the meeting temporarily, just let the staff know so we'll know for the meeting minutes. I don't think everyone is back, so we're gonna wait a little bit. Okay, just to see where everyone is, I'm gonna take a roll call really quick. So, Maria, are you back? Maria? I don't hear Maria. We'll go to Jig. Jig, are you back?
Yes.
Hi, Jig. Indira?
Staff has been advised that Ms. Cameron Banks did need to step out for a moment.
Okay. Jesse?
I'm back.
Thank you, Jesse. Jose?
Present.
Thank you, Jose. Kula's not yet in, right? So we'll do Ricardo.
Yeah, I'm here.
I see Ricardo. Perfect. Nicole?
I'm here.
Thank you, Nicole. Jason?
I'm here, Sung.
Thank you, Jason. And I'm here. 1, 2, 3, 4.
Can you hear me now?
Oh, yeah, I can hear you, Maria. Perfect. All right. So with that, we will get back here to agenda item 8, Medication Error Reduction and Workforce Committee Report. Members, I'll now turn the meeting over to Nicole for a report on the work of the Medication Error Reduction and Workforce Ad Hoc Committee. Nicole, floor is yours. Thank you.
Thank you, President O. Good morning, members. Thank you for the opportunity to provide an update on the efforts of the Medication Error Reduction and Workforce Committee at its June 22nd, 2022 meeting. Thank you also to my fellow members, including Vice Chair Sung Oh, Jesse Crowley, Kula Koenig, and Jig Patel. During our meeting last month, the committee continued its education on efforts undertaken by other agencies related to workforce issues and medication errors, including 3 great presentations. The first presentation received was from Bill Cover, Associate Executive Director, State Pharmacy Affairs with the National Association of Boards of Pharmacy. Mr. Cover provided information on the NABP's task force report and the recommendations coming from the task force. The recommendations are detailed in the meeting materials, and the presentation slides are included in attachment 1. During our meeting, we noted that many of the recommendations are outcome focused. Based on information received during prior meetings, as I shared during the committee meeting, I agree that training on continuous quality improvement is important. During the committee's January meeting, I was surprised to learn that pharmacy education may not address learning continuous improvement process, which may result in some new practitioners not having training on how to implement such a process. I also want to highlight one of the comments received during this portion of our meeting that related to medication error reporting. The committee was advised that some corporations do not allow for the staffing of the pharmacy to be listed on medication error reports. Moving forward, I suggest this may be an issue for the committee to consider. As we are evaluating medication error reduction in workforce, such information appears to be an intersection of the two issues, and that such data appears both relevant and necessary. Members, do you have any questions or comments on the presentation? Okay, seeing none, moderator, please open the line for public comment.
Thank you. I'm opening up the Q&A panel, and if any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We are displaying instructions, and we'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, next is the presentation by the American Pharmacists Association on the Well-Being Index, Pharmacists' Fundamental Responsibilities and Rights, and Survey Results. During our meeting, we also received a presentation from April Shaughnessy, APHA Well-Being Initiative Program Project Manager. During the presentation, members were provided with an overview of the Well-Being Index tool, and that information suggests that a pharmacist at risk of high distress is, among other things, at a twofold higher risk of medication errors. Ms. Shaughnessy also discussed the Pharmacist's Fundamental Responsibilities and Rights document developed by APHA and the National Alliance of State Pharmacy Associations. The document outlines fundamental responsibilities for pharmacists, building upon the principles of the Oath of a Pharmacist and Pharmacist Code of Ethics, and certain workplace expectations that are needed to fulfill these responsibilities. As you may recall, one of the recommendations from the NABP task force was to endorse this fundamentals document. The presentation also included a review of the APHA workplace reports and data that suggested that pharmacy personnel report harassment and bullying from patients without support of their employers. During our meeting, we were advised that this dynamic is a real concern for pharmacists and could also be a cause of medication errors. During our discussion on the issue, members suggested development of a campaign highlighting the value of pharmacists. Members also noted that many of the responsibilities and rights included in the fundamentals document are directly related to the work of our committee. Attachment 2 includes several items related to this agenda item, including the presentation slides, the Well-Being Index, and the fundamentals document. Members, do you have any questions or comments on the presentation? Okay, seeing none, moderator, please open the line for public comment.
Thank you. I've opened up the Q&A panel. Anyone who would like to comment can type comment using the field in the lower right-hand corner of the screen and submit it to all panelists, or you may simply raise your hand. We're displaying instructions, and we'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Yes, thank you.
Welcome.
Okay, and next is the presentation by the Nova Scotia College of Pharmacists on the Nova Scotia Workplace Conditions Strategic Work. The final presentation we received during our meeting last month was from Beverly Zwicker, the CEO and Registrar of the Nova Scotia College of Pharmacists on their Workplace Conditions Strategic Work. During the meeting, we learned that similar to the board, the Nova Scotia College of Pharmacists is also concerned with the rise of medication errors, which results in suboptimal care for patients. Ms. Swicker detailed the process used by her agency to evaluate the issue, including review of literature, interviews with pharmacy practitioners, surveys, interviews with other stakeholders, and surveys of pharmacy managers. The literature was clear about the link between workforce issues and the quality of care provided and risk of medication errors. I note these conclusions appear consistent with the information in California we have reviewed, including the public comment and survey response received. From a process standpoint, the next steps under consideration by the Nova Scotia College of Pharmacists is potential interventions based on identified barriers and research, including development of a staffing formula. In their jurisdiction, there is a requirement for pharmacy managers to ensure that a staffing plan is commensurate with the needs of the patient receiving care in the pharmacy. Following the presentation, members expressed interest in exploring the option of conducting similar research in the staffing formula in California. We will continue to monitor the efforts of the Nova Scotia College of Pharmacists, including any research that is conducted related to development of a staffing formula. Members, do you have any questions or comments? Yes, Maria.
Hi, thank you. I just wanted to state that I was able to listen into your meeting as a member of the public and found it very informative. Would encourage that members of the board go back and look at the WebEx, and if they have an opportunity to hear these presentations, it was an excellent and eye-opening.
Thank you. Members, any other questions or comments? Okay, seeing none, moderator, please open the line for public comment.
Thank you. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand and we'll give you a moment. All right, I see no requests for public comment. Shall I close the Q&A panel?
Yes, please.
Okay.
And this concludes my report. President O, I turn the meeting back to you. Thank you.
This is the moderator. I believe President O is muted.
Oops, sorry. Not sure where. I think I was just saying that thank you, Nicole. And now we're moving on to agenda item 9, Communication and Public Education Committee. Members, I'll turn the meeting over to Ricardo for a report on the efforts underway by the Communication and Public Education Committee. Chair Sanchez, the floor is yours.
I would help to take the mute off here. Hi, I'm Ricardo Sanchez, the chairperson of the Communication and Public Education Committee. This report is a summary of the committee's meeting on July 19th, 2022. Item A was the discussion and consideration of providing education to licensees about the Institute for Safe Medication Practices. So a little on the background, the Medication Error Reduction and Workforce Committee received a presentation in January 2022 about the Institute for Safe Medication Practices. The acronym is ISMP. ISMP also provides many tools and publications to help healthcare workers prevent medication errors. The Medication Error Reduction Committee suggested the Public Education Committee consider opportunities to educate licensees about ISMP and its resources for preventing medication errors. At the Public Education Committee meeting July 19th, the staff recommended posting a link to ISMP on the board's website and publishing an article in the script about ISMP and its resources for preventing medication errors. Committee members supported the recommendation. There was no public comment. Are there any board member questions or comments? Okay. Are there any public comments? Commentator, can you open it up to the public for comments?
Thank you. I've opened up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please.
Okay.
Okay, thank you. We'll now move on to our section B as in boy. This is the discussion and consideration of providing naloxone educational materials for pharmacists. A little background on that. At the July 2021 meeting of the Enforcement Committee, members and speakers discussed challenges in getting pharmacists to furnish naloxone. Some said pharmacists are too busy to furnish naloxone. Others said that the naloxone protocol requires pharmacists to engage with patients. But many pharmacists are uncomfortable or do not want to engage with patients. The Enforcement Committee recommended the Public Education Committee develop educational materials to assist pharmacists in understanding the value of naloxone and how to operationalize naloxone distribution. At the Public Education Committee meeting, July 19th, staff noted the board's websites provides many resources for pharmacists furnishing naloxone, including a training webinar, facts and questions, simple naloxone labels, fact sheets, and screening questions in multiple languages. Staff recommended publishing an article in the script about the board's online resources to assist pharmacists in furnishing naloxone. Committee members supported the recommendation and said the article should include examples of how to operationalize furnishing naloxone in retail pharmacies. There was no public comment. Is there any board member with a question or comment? Okay, hearing none. Commentator, can you please open it up to the public for comments?
Thank you. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We'll give you a moment.
Before we continue, I think that there was
I thought I
one
saw
of our
someone raise a
colleagues,
hand.
Jessica, had raised a hand.
Hi, yeah, thank you. Sorry about that. I just wanted to note, I appreciate that this committee took on this work. In my experience, I think one of the barriers to prescribing is that oftentimes a lot of pharmacists don't even know how to initiate the conversation with patients about recommending it. So just as an example, if a patient is on an opioid medication in combination with other medications that increase sedation and risk of overdose, a lot of pharmacists don't want to offend patients. So what ends up happening, I think, is a missed opportunity because they don't want to offend and they don't want to walk on toes. So I think some education on a good conversation starter and maybe like a practice with pharmacists would help. And one of the other things too that I've noticed is that sometimes naloxone can be extremely expensive for patients. So say if someone is discharged on an opioid medication and maybe their opioid costs $5. I've seen naloxone cost, $150 plus. And so when we have circumstances like that with a medication that could be life-saving, a lot of the times there is a financial barrier. So that's just something that I wanted to point out as well. But I think it also starts with getting pharmacists to be more comfortable with initiating the conversation.
Very true. Thank you for your input, by the way. Any other member comment? Okay. Commentator, can you open it up to the public now?
Thank you. So the Q&A panel is available, and also members of the public may raise their hand if they wish to comment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please.
Okay.
Thank you. We'll now move on to section C, which is the discussion and consideration of public awareness campaign, treating your pharmacy staff with courtesy. A little background on that. The Medication Error Reduction and Workforce Committee received a presentation in June of 2022 from the American Pharmacists Association about the Well-Being Index for the pharmacy personnel. The index is an online tool that healthcare professionals can use to self-assess their well-being. The index tracks levels of well-being and distress among pharmacists, student pharmacists, and pharmacy technicians nationally and by state. The Medication Error Committee expressed concern that a general lack of respect for pharmacists among the public compared to other professionals may contribute to the distress on the job. Licensing members describe being bullied and harassed by customers and being belittled as just putting pills in a bottle. At the Public Education Committee on July 19th, committee members supported developing a campaign to increase public awareness and appreciation for the role of pharmacy professionals in providing and protecting patients' health. Members also directed staff to seek out partnerships with other agencies in developing the campaign and to educate the public about what pharmacists do to ensure consumer safety. There was no public comment. Is there any board member questions or comments?
Hi, Chair Sanchez. This is Song. I think that this is a great idea, and I hope that we can improve awareness of what pharmacists do looking forward to what the committee comes out with.
Yes, we're always looking to improve our website and getting the information out. But thank you. Any other board member? Any comments or questions? Hearing none, seeing no little hands being raised. Are there any public comments? Commentator, can you open it up to the public?
Thank you. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen, or you may simply raise your hand or displaying instructions, and we'll give you a moment.
Hi, this is Anne. I apologize for the interruption. Just wanted to quickly note that member Cameron Banks is back.
All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
We will now move on to section D. That's the Senate resolution designating September 2022 as Opiate, Heroin, Fentanyl, and Prescription Drug Abuse Awareness Month. Some background on that. State Senator Patricia Bates has introduced Senate current resolution 115 to designate September 2022 as Opiate, Heroin, Fentanyl, and Prescription Drug Abuse Awareness Month. The measure is intended to increase public awareness of the dangers of abuse of opiates, heroin, fentanyl, and prescription drugs. The resolution contains important legislation findings, including in 2020, more than 14,800,000 opiate prescriptions were written in California. From 1999 to 2020, inclusive, more than 500,000 people died from overdoses related to opiates in the United States. Fentanyl is 50 times more potent than heroin and 100 times more powerful than morphine. The number of deaths from fentanyl overdoses increased by more than 2,100% in California in 5 years. At the Public Education Committee on July 19th, staff recommended posting the resolution on the board's website under prescription drug abuse prevention and developing a social media campaign highlighting consumer information on the website. Committee members discussed the problem of opiate abuse and strongly supported the recommendation. There was no public comment. Are there any board member questions or comments? I see the hand up. Go right ahead.
Hey, yeah, this is Jessie again.
Hi, Jessie.
I think it's wonderful that the board is taking this on for the month of September. I do want to highlight the importance of that last part of prescription drug awareness. You know, it's my understanding after reading a recent Pharmacist letter article that non-opioid overdoses have also increased over the last few years, with gabapentin and benzodiazepines being a huge contributor to that. So just for some more context, gabapentin is a non-opioid pain medication used for nerve pain, and benzodiazepines are typically used for things like anxiety. So I think it's important for the public to understand that there are medications outside from pain medications that can be potentially dangerous for them. I don't think the public understands that so much, because so much of the media attention on overdoses is focused on opioids. So I really appreciate that you all are taking this on.
Thank you. Is there any other board member questions or comments? Okay. Well, hearing none, commentator, can you open it up for public comments?
Thank you. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We're displaying instructions, and we'll give you a moment.
Again, apologize for the interruption. While we are waiting for public comment, Member Koenig has had the opportunity to join. If we could please do a quick mic check, please. Thank you.
Hello, everyone.
Great, we can hear you. And this is the moderator. I don't see requests for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
We will now move on to our item E, which is the update on communication and public education activities by staff. And Anne, would you like to elaborate on the script, staff outreach, news media, and educational resources?
Sure, happy to. Just the board meeting materials do detail out the efforts undertaken over the last quarter. The next issue of the script is well underway. We hope to have it released in the next month or two. It'll focus on the same types of things as in the past, including changes in regulations that have occurred since the last issue of the script was released. You'll be hearing later on today about some of the information that was recently released through the Enforcement Committee. Certainly don't want to steal the thunder from Chairperson Serpa, but some of the information from there will also be included. With respect to staff outreach, it is included in there. Happy to report that we're doing a lot of outreach with the schools to try to assist their students that are graduating with understanding the process to secure licensure in California, in the hopes that providing that information will assist them in their application and licensure process. In addition, we've had the opportunity to attend and provide trainings. The news media information is out there as well. So thank you. I'll turn it back to you, Chair Ricardo Sanchez.
Thank you. I was going to ask for any questions or comments from our board members, but I see that Jessica has her hand up. So go ahead, Jessica.
Hi, I know, sorry, lots of comments today.
Oh, it's
I
fine.
was wondering if maybe our staff can consider putting together a virtual informational session for out-of-state applicants. I know as someone who went to school out of state, my school had zero resources on the process of applying for licensure in California. And I know similar out-of-state students have experienced similar difficulties and still do. So I think that may be another great resource for out-of-state applicants potentially, or something that we could look into.
Good point. We'll take that into consideration. We'll forward it for staff to look into. Is there any other comments from any of the board members? Okay, seeing none. Commentator, can you open it up for public comments?
Thank you. I've opened up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, thank you.
You're welcome.
And I would just like to say thank you to the committee members for making this one of the smoothest communication and public education committees. We seem to get a lot accomplished, and the last meeting was definitely had a lot of material, and we went through it thoroughly. So thank you. This concludes the report of the Communication and Public Education Committee. Thank you.
Thank you, Chair Sanchez and all the committee members. Okay, so we're moving on to the next agenda item, agenda item 10, Licensing Committee Report. Members, as we begin our review of a summary of the committee's July 18th, 2022, I'd like to acknowledge the work of the members of our committee, including Jake Patel, Vice Chairperson, Indira Cameron-Banks, Jessica Crawley, and Jason Wise. Discussion. So starting with the first item is discussion and consideration of Business and Professions Code Section 4111 related to ownership prohibitions of pharmacy licensure. During our meeting last week, the committee discussed several items, including Business and Professions Code Section 4111, which specifies that the board shall not issue or renew a license to conduct a pharmacy to an individual authorized to prescribe, as well as to a person who shares a community or other financial interest with a prescriber. The meeting materials provide background information on the issue, including some history on the issue. As included in the meeting materials, California is a community property state, which generally means that property acquired by either spouse during a marriage is presumed to be equally owned by both spouses. There are some exceptions, such as prenuptial agreements, where property acquired may not be community property depending on the agreement of the parties. The meeting materials provide some historical information related to the application process and assessment of prescriber ownership prohibition. As the board became more adept at evaluating information, it discovered that representations made by applications were not substantiated by requested information. During our meeting, we considered the issue to determine if the current provisions are appropriate or if there is a means by which the legislative intent could be preserved while creating a flexibility for an otherwise authorized individual to own or operate a pharmacy, and possible statutory language that could balance the intent of the provisions of BPC 4111 while establishing some flexibility for ownership of individuals seeking to own pharmacies with familiar relationship to a prescriber. There appears to be general consensus among committee members that the language provided would be appropriate. However, after public comment was received, the committee tabled its motion recommending approval of the proposed language. Specifically, public comment suggested that expansion of ownership authority should be included in BPC 4111E, as in Edward, to allow pharmacists working under a collaborative practice agreement to own and operate a pharmacy. As this was not contemplated in the development of the proposal, the committee is not offering a recommendation at this time. Members, do you have any questions or comments on this issue? Okay, moving on to public comment, please, Tricia.
Thank you. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no request for comment. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
We will provide future updates on our discussion at subsequent committee meetings. Next item is discussion, consideration, and possible recommendation to the board to approve draft regulations to implement provisions of Assembly Bill 107 related to requirements to issue a temporary license. Members, recently enacted legislation requires the board to issue temporary licenses to practice professions under specified conditions, including a background check and passing a California law and ethics exam. To implement this legislation, the board needs to promulgate regulation to define the application requirements. Provided in the attachment 2 is the draft regulation language considered by the committee. The meeting materials highlight some areas where the draft regulation language would vary from other areas of pharmacy law, including the requirement to provide the board with an email address. Thank you again to Council for their respective efforts to provide comments back on the draft language that allowed for consideration by both the committee last week and review by the board today. This should ensure the regulation process will be completed by July 1st of 2023. The slide displays the committee recommendation, which is also included in the meeting materials. Members, do you have any questions or comments for the committee? Seeing or hearing none, we will open up for public comment. Moderator, please open the line for public comment.
Thank you, Mr. Board President. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. We'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you.
Welcome.
Having received no public comment, we're going to go for vote. Maria, how do you vote?
Yes.
Thank you, Maria. Jake, how do you vote?
Yes.
Thank you, Jake. Indira, how do you vote?
Yes.
Thank you, Indira. Jesse, how do you vote?
Yes.
Thank you, Jesse. Jose, how do you vote?
Yes.
Thank you, Jose. Kula, how do you vote?
Yes.
Thank you, Kula. Ricardo, how do you vote?
Yes.
Thank you, Ricardo. Nicole, how do you vote?
Yes.
Thank you, Nicole. And Jason, how do you vote?
Yes.
Thank you, Jason. And I vote yes, the committee motion passes. Moving on to the next item is discussion and consideration of current pharmacy technician authorized duties, current pharmacist and pharmacy technician ratio, and possible changes. During our meeting, the committee continued its discussion on pharmacy technicians, including authorized duties, technician ratios, and possible changes. As a quick recap, in April, we convened the Pharmacy Technician Summit, where as a committee, we discussed the results of the listening sessions and surveys, information at the national level, and research on various related topics. As detailed in the meeting materials, during the committee's discussion in April, members reached some consensus on some areas, including possible new duties for pharmacy technicians, including authority to administer vaccinations, authority to receive verbal prescriptions and transfer prescriptions, and authority to perform some aspects of CLIA wave testing. We used the prior discussion as a springboard for our discussion last week, where as part of our discussion, we considered several policy questions. The policy questions and general summary information is included in the meeting materials. As that information is already detailed, I wanted to share the general concepts where I believe the committee has reached consensus. Staff will use this information to develop the general parameters for proposal for the committee to consider at its next meeting. General parameters include a recommendation that pharmacy technicians be provided authority to accept verbal prescriptions and transfers and accept clarification on prescriptions that do not require professional judgment. Further, the proposal will include provisions for pharmacy technicians to administer vaccines and epinephrine under specified conditions, including completion of necessary training, followed by authorization by the PIC for the technician to perform vaccine administration, provisions for additional pharmacy technician staffing, including an increase in the pharmacist to pharmacy technician ratio, where one of the pharmacy technicians is administering vaccines. In addition, the proposal will include provisions for a pharmacy technician to perform specified tasks related to CLIA waive tests under specified conditions, including training requirements and authorization by the PIC for the pharmacy technician to perform such tasks. The committee has requested that staff begin working on a draft proposal. During our next meeting, we will consider the general parameters of the proposal and consider some outstanding policy questions, including consideration of continuing education requirements and consideration of inclusion of a national certification requirement for pharmacy technicians performing expanded duties. As noted in the meeting materials, the committee did not reach consensus on changes to the ratio beyond for purposes of vaccine administration. As such, for purposes of moving forward this proposal, the issue of ratio beyond for vaccine administration will not be considered at this time, but may be considered as part of a future discussion. I believe this approach is appropriate as it will allow the committee to continue moving forward in areas where there is consensus. During the meeting, we received public comment that expressed concern for the current workload of pharmacists and the need to ensure appropriate staffing. It was suggested that the proposal include strong anti-retaliation provisions for PICs. Some comments expressed support of national certification and continuing education requirements, while others expressed disappointment that the committee would not be considering an increase in the ratio beyond duties related to vaccine administration at this time. Members, this is a very loaded item, so just will make sure that I give everyone opportunity to comment or speak. So please feel free to chime in, raise your hand, or I can actually go down the roll if that may be better. So go ahead, Jose.
There you go. How's that for a raised hand, right? So the ratio, is there a formula that could be shared? Maybe I missed the formula. I know what's recommended, the technicians per pharmacist, but how do we arrive to that formula to begin with? Was the ratio based on volume, right? That is, produced to the public, the services. How did that ratio come about? And is that the right formula moving forward? Because I think the technician ratio to pharmacists might be off, but it looks like it might have been established at one point, but is that the proper formula moving forward? I think, how's that? How do we arrive to it would be good for me to understand. Maybe others have the same questions, but how do we potentially look at the formula as the underlying way of moving forward? Volume equals X, number of technicians and pharmacists, then that probably might make more sense to me versus just saying we need more bodies. Well, why do you need more bodies? Why is everyone so overworked? Why is the stress so high? How does that affect customer service or safety of the patients or consumers? All that has that trickle effect. I think the formula might be off. I think it's looking at that formula, those ratios for me to then say what possible changes might be proposed. Just my 2 cents.
Thank you. It was a great comment and excellent thought. I'm going to put spot on Anne. If she could provide some highlights, because I did this in the committee meeting, just some historical backgrounds on the discussion of tech to pharmacist ratio in general. If Anne could just provide some historical background. And I think, Jose, just want to clarify, this is about moving forward discussion, right? Not just trying to understand the past. But I think that might help. Our discussion is just to kind of understand the concept of ratio in general, what other states are doing, where this kind of came from, and why we landed at this discussion at this point. So I'm hoping that I'm capturing your thoughts there, and I'm hoping I'm putting Ann on the spot, and I'm going to mute myself, and Ann can just kind of provide a little background on there.
All right, so with respect to the ratios specifically, Jose, they have been discussed and considered, in the past by this board, and there's been previous legislative efforts to change those by, others in the industry supporting or, concerned about changes in the ratio. But I think the question, the fundamental question that I'm hearing from you, I think really actually kind of speaks to some of the studies that maybe, Nova Scotia might be undertaking, because it really kind of gets to what is that appropriate staffing level for a pharmacy. And I think that different committees have heard concerns about current workload. I think we've also heard, that maybe some of the staffing levels are established just based on the prescription volume and maybe don't include all of the other services that pharmacists provide, the clinical services, et cetera. So I think that it's a great question. I think that it's something that the Medication Error Committee is also trying to kind of look at, because there's so many items that the board does that are interrelated. And so I think with respect to the expansion of the tech duties and the ratio specific to that, which I believe is what the committee is really focusing on right now, they've been operating under this amended ratio as part of the DCA director's waiver, and that's been in place for quite a bit of time. So I think that maybe there's a little bit of comfort with respect to increasing it there, just because that's kind of how it has been working, and certainly not trying to speak for the committee. It seems from the staff level that there's not really otherwise consensus on how best to move forward. So we may need to look and see what those what research is going to show us in terms of workload analysis to see if we can determine what, if any, changes would be appropriate to the current ratio. The only other thing that I'll just quickly highlight, should it be helpful information, is that a lot of times members will hear about different states and different approaches to the ratios. And I just want to just quickly highlight that that may not necessarily be an apples to apples comparison. In different states, different technician duties vary from different states. And in California, for example, there is no ratio that for clerk typists. So unlicensed individuals, a pharmacy can have an unlimited number, and they can do a lot of things that still require pharmacist supervision. So when we do talk about, in general, what other states are doing or what's happening nationally, it's very important to have those conversations, but then also understand where there are similarities, but also where there are differences that may actually lead to a different outcome in California. I hope that that was helpful.
Yeah, I think it's in top of many of the communities that I've visited, and top of mind, where you have a large pharmacy with a lot of volume, and it doesn't look like they're staffed appropriately, and there's a lot of duties already on the pharmacists. I think we're hearing it or seeing it across every committee. The ratios are probably off in some instances, but this will be an ongoing, I think, effort from everyone to try to get a good balance. But thank you.
Thank you, Jose. And I think that's, I'm not trying to touch the hornet's nest, but I think what you're bringing up is an excellent discussion, which is to try to figure out, is there because this ratio we're discussing is talking about a ceiling, but is there a floor that there can be a way And I think the ceiling concept was developed way back just because and I could be wrong, but just for historically, I think it was because ability for one pharmacist to supervise a technician, it was just one-to-one was just the original concept. And that direct supervision, I think that definition of that also had something to do with just this very tight ratio. And I think as the profession evolved and the practice of pharmacy evolved, you know, we are kind of need to look at now, is there a floor? Is there a ceiling? What's the right approach? So I'm so glad you bring this up, and thank you for bringing it up. So anyway, go ahead, Jesse.
Just, you know, the last thing, and I will hand it over to my colleagues. You know, the focus, of course, is, you know, consumer and patient safety. You know, I know that a lot of, you know, large chain locations, you know, it's run by a corporation. So, you know, P&L, bottom line, all of that, you know, plays into, you know, the profit and losses. I think it's, you know, the ratios to make sure that the technicians do have, you know, the right balance, and, you know, they don't feel, you know, under the gun when, you know, they're trying to balance too much, and the pharmacists have the right support as well. I think there'll be an ongoing discussion, but anyways, I'll hand it over to my colleagues.
Hey, this is Jessie. I just want to echo everything that Jose was saying. I think I'm strongly in support of considering a minimum staffing requirement rather than adding more duties onto one individual. I think it makes more sense to have more hands on deck when possible. I also want to highlight that I'm in support of a national certification. And we did talk about continuing education for technicians who do provide expanded duties. I want to highlight that a lot of the national certifications already include continuing education requirements for technicians. I don't think I highlighted that at the meeting, so I just want to notate that it may not require us as a board to establish additional continuing education if we just use one of the national certifications for technicians providing expanded duties. And then just wanted to echo also support for strong anti-retaliation language. And I'm not sure if we're actually to that point, but I do think it's very important that a pharmacist in charge is able to sign off on a technician doing expanded duties, and that the technician themselves also wants to perform those duties and doesn't feel pressured into it.
Thank you, Jesse. Any other comments? No comments? I'm surprised. Okay. All right. We're going to open up for public comment. We're moving way too fast, so we might have to take an early lunch. So get ready, get your microwave ready, whatever it is, or DoorDash open. All right. Public comment, please.
Thank you, Mr. Board President. I've opened up the Q&A panel. If anyone would like to make a comment, please type comment and submit it to all panelists using the field in the lower right-hand corner of your screen, or you may raise your hand. And I do see we've got several requests for public comment. The first is from Lindsay Gulahorn. And Lindsay, a moment, I'll find you. Okay, Lindsay, you should be able to unmute yourself.
Thank you. Good morning. This is Lindsay Gulahorn with the California Retailers Association and the National Association of Chain Drugstores, and just want to say that we're pleased to see the board discussing this issue, the role of technicians in the workforce and the ratio. Certainly know and recognize that pharmacy technicians are invaluable members of the pharmacy team, and we support the expansion of technician duties, including permanent authorization for immunizations. Also appreciate the discussion regarding expansion of the ratio. With respect to the vaccine, we do believe that the ratio should be expanded generally to include other duties and not be limited to vaccinations. And want to recognize and appreciate the information and presentation provided by the Nova Scotia College of Pharmacists, the work that they are doing, but want to note that The Canadian healthcare system is a lot different from the United States. So as we look at that and explore that, we just encourage the board to keep that in mind. So just in some, definitely think one of the most significant ways that we can make changes to improve patient care, consumer safety, and reduce workforce pressures to expand the ratio. Understand that it's a complicated topic, and just are happy that the board is exploring this, and we look forward to engaging with the board further as this proposal is developed. Thank you.
All right, the next request for comment is from Mark Johnson. And Mark Johnston, you should be able to unmute yourself.
Thank you. This is Mark Johnston representing CVS Health. Many of you may remember me from NABP, where I was elected to the executive committee as the executive director of the Idaho State Board of Pharmacy. Thank you very much for the ongoing discussion today. I've enjoyed it. Jose, to give you a little background on ratio, half the states in America do not have a ratio, and the movement nationally is to increase that ratio. For example, Louisiana has a proposed rule to go from 3-to-1 to 4-to-1. West Virginia has an open comment period on their proposed rule to go from 4-to-1 to 6-to-1. Overwhelmingly, California has the lowest ratio in the nation, understanding Ann's comments about technician duties. When I see the proposal to increase the ratio in California only when immunizing, first off, I appreciate that for when immunization clinics are in session. You know, when a technician is busy for a full shift, immunizing, not taking that count and poor technician out of the pharmacy, it has been huge for us. However, moving forward, as immunizations are moved more into workflow, it isn't really practical to have a second technician in the pharmacy who is only there for immunizations when immunizations aren't happening on a current continuous basis. I've heard both the board and the public say that when their count and poor technician has to leave to go immunize, it's a strain on the pharmacy, and that's the driver to increase the ratio. But if the ratio is only increased when immunizing, and immunizing isn't performed on a continuous basis, I don't see where pharmacies are going to add an immunizing, a second tech who's going to, stand around and not be able to count and pour, just waiting for the next immunization. I think it's a proposal that really results in no ratio increase. So in addition, that same argument, when we've heard pharmacists say they need a second technician when their techs are immunizing, well, now we'll have techs taking new verbals and transferring, clarifying, and helping with CLIA waived, which I totally support. That's awesome. But in the same breath, that takes your count and poor technician away to go do those duties. And if a second technician is only available for immunizing, then you won't have your count and poor technician when your technician goes to perform a CLIA waive test, transfer, take new verbals, etc. So honestly, it seems like a broken proposal, and I would certainly welcome more discussion on an increase to a permanent of 2-to-1, as well as a floor of 1-to-1, and I certainly appreciate all the expanded duties being discussed. Thank you.
All right, the next comment is from Paige Talley, and Paige, you should be able to unmute yourself.
Talley, representing the California Council for the Advancement of Pharmacy. And first, I want to say I totally agree with the two previous speakers, Lindsay Goldhorn and Mark Johnston, regarding ratios and everything else they said about the licensing committee. And I'm sure that the licensing committee does know my feeling on ratios, but I want to say that I do appreciate and understand the need to continue with the DCA waiver and make it regarding the COVID, the vaccinations. But I'm pleased to hear that the board plans to address increasing ratios in other practice settings across the board. And I hope that's sooner than later. And I would rather have it now, but that's not up to me. Thank you.
All right, and the next comment is from Pat Whalen. Pat, you should be able to unmute yourself.
On behalf of United Nurses Association of California Unions of Healthcare Professionals, we have approximately 33,000 members, including many pharmacists, a lot of whom work in Kaiser or other hospital settings. We just want to note that while we appreciate the discussion on ratios, UNAC does remain very concerned about the discussion of increasing ratios. We think it's a very complicated issue that merits a lot of discussion. And we would just note that the survey results that were referenced in the board meeting materials appear to be a relatively small sample size compared to the total number of pharmacists out there. Thank you very much.
Okay, and that is the end of requests for comment. Shall I close the Q&A panel?
Yes, please. Thank you, Tricia. Thank you for all the comments. Okay, with that, any other comments before I move on to the next item? Okay, moving right along. Next item is licensing statistics. Attachment 3 includes the year-end and 3-year comparison licensing data. There's a lot of data provided. I noted that the data indicates a 4% overall growth in the receipt of applications for initial licensees, with the most significant increase in the number of pharmacy technician applications. There has also been a slight increase in overall exam applications, exam and retake combined. It is interesting that there is a large drop in the number of intern applications received over the 3-year period. There has been an overall decline in the number of site applications received. There appears to be an overall growth in pharmacy applications received when combining chain and non-chain applications received. However, looking at the data separately, there's about a 13% decrease in non-chain pharmacy applications received. There are also increases in several of the board's non-resident business licenses, including non-resident pharmacy applications, non-resident sterile compounding applications, and non-resident third-party logistics providers. There was a significant increase in the number of temporary applications received for the 3-year period, including a 16% increase in the number of temporary pharmacy applications received. Staff has previously identified this growth as one of the contributing factors for site licensing processing time. Included in the recent budget is additional staff resources to assist with the workload associated with this growth. There appears to be a significant drop in the denial of applications for individual licenses. I would assume that is at least in part attributed to changes in the law that preclude the board from considering some past arrest and conviction information. I found it interesting that there has been a 20% increase in the number of chain pharmacists discontinuing businesses, while there has been a 33% decrease in other pharmacists discontinuing business. The board's overall licensees, however, population remains about the same. Public comments suggested that the decrease in pharmacy intern applications could be a reflection of the difficulty pharmacy schools are having in recruiting students. It was suggested that the board monitor the issue of potential or future workforce shortages. Processing times exceed performance standards established by the board. As I mentioned during the organizational development report, the board has 7.5 vacant positions within its licensing unit. I would expect that as positions are filled and staff onboarded, we'll see improvement in processing times. Members, do you have any questions or comments on the data provided? Okay, hearing none, moderator, we're going to open up for public comment.
Thank you, Mr. Board President. I have opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or you may simply raise your hand. We will give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Yes, please. Thank you.
You're welcome.
So that concludes Licensing Committee's report, and it is 11:20. So our timing is very awkward. So I'm gonna open it up for our members to decide if you want to push forward for enforcement compounding report. I'm not sure, our Chair Serpa, if you're ready. It might be less than an hour as well. And then we have a closed session after, so we could just go to the enforcement meeting, and then we'll take a lunch, and then we'll reconvene in closed session, if that works. How's that sound for everyone?
Keep the ball rolling.
All right, I see the thumbs up, so we're gonna go right ahead. So now
President
moving
Ho?
on to agenda.
Sorry,
Yes,
sorry.
yes.
I'm fine with that, but could we just get a 5-minute quick restroom break?
Sure, of course. We'll come back at 11:25.
Perfect, thank you.
Just gonna take a quick roll to make sure everyone's back. Maria, are you back?
Here.
Thank you, Maria. Jig, are you back?
Yes, thank you.
Thank you, Jig. Indira, are you back?
Yes, I'm here.
Hi, Indira. Thank you. Jesse, are you back?
I'm here.
Thank you, Jesse. Jose? I don't think Jose is back yet, so I'll come back to Jose. Kula, are you here? I think I lost Kula's video, but okay, Jose and Kula, I'll come back. Ricardo, are you back?
Yeah, I'm back as well.
All right, thank you, Ricardo. Nicole?
I'm here.
Thank you, Nicole. Jason? There you are. Hi, Jason. Okay, and then just waiting on Jose and Kula.
Oh, I'm here,
Jose.
President. No. Yeah.
Oh, thank you. Thank you, Jose and Kula. We'll just let Kula know to announce when she comes back, and I will hand the meeting to our chairperson, Maria Serpa, to provide a report on the activities of the Enforcement and Compounding Committee. Chair Serpa, the floor is yours. You're muted, Maria.
I got the mutitis disease. Sorry about that.
Yeah, I do too.
Thank you for announcing me and for letting me know that I was on mute, President O. And thank you to everyone for hanging with us before lunch. I appreciate that. On behalf of the committee, I'm pleased to provide the board with a summary of our efforts from our meeting last week. I wanted to thank my fellow members, Vice Chair Jig Patel, Renee Barker, Indira Cameron Banks, Sung O, and Ricardo Sanchez. The first item is item A, discussion, consideration, and possible recommendation to the board to approve draft changes to CCR section 1715.1 related to self-assessment of an automated drug delivery system by pharmacists in charge of unlicensed AUDSs. There's a lot of jargon here, so I'll try to go a little bit slowly. The relevant sections of pharmacy law are detailed in the meeting materials, establishing requirements for the use of automated unit dose drug delivery systems referred to as AUDSs under specified conditions. Specifically and related to this agenda item are those AUDSs that are exempt from licensure by the board, but must otherwise comply with all other requirements for an automated drug delivery system. One such requirement is the completion of a self-assessment form for the ADUS. Although the relevant regulation currently provides that a self-assessment must be completed annually, subsequently enacted in statutory changes modified this frequency to the completion of the assessment to every odd year, which is consistent with the required frequency to complete self-assessments for other licensees. So just as a reminder, we have already considered that change and we voted to update the regulation section to be consistent with the statute. That regulation is still pending, so our work on that part is done. However, during last week's meeting, the committee considered policy goal of self-assessment requirements specifically related to unlicensed AUDSs used in hospitals to determine if the board should provide clarification to the regulation when a hospital is using the same device with the same policies and procedures on the same computer platform, and if completing a single self-assessment form would be more appropriate. Such devices operate in the same manner and under conditions just outlined about that I just talked about, and would yield the same results related to compliance with the provisions of pharmacy law, whether one self-assessment form was completed or several self-assessment forms were completed, they would be exactly the same. As I shared during the meeting last week, I have a background in hospital pharmacy, and I know that large hospitals can have well over 100 AUDSs in a single building. Because the manufacturer is the same and the policies and procedures are the same, as is the staff, coupled with the fact that the programming managing the device will operate under a single platform, I believe completion of only a single self-assessment is appropriate. There's no need for the PIC to complete more than 100 forms when they would be exactly the same. As reflected in the committee's recommendation included in the meeting materials and displayed on this slide, there it is, the committee is recommending adding proposed language to CCR 1715.1 to clarify the board's policy for a PIC to be required to complete a single self-assessment under specified conditions. Attachment 1 includes the language that was approved by the committee. So that's a little bit confusing. If you look at attachment 1, as I previously stated, we have current regulation change pending on this. So when you review the language, you will see the additional part is reflected with a double underline and a double strike through. That's the part that we're considering today. The other change is already going through the process. To ensure we have a common understanding of the potential changes, I would like to quickly review the changes related to the committee's discussion. So if you look at attachment 1, 1715.1B2 appears to just be a change to simplify the language. And we do have slides on this so you can help to follow along. 1715.1C5 and C6. I think there's another slide for this. Oh, there it is. C5 and C6 update the language to be gender neutral. And then 1715.1F is the new language that we discussed in the committee. That would clarify the board's expectation related to completing the self-assessment form for unlicensed AUDSs used in a hospital. You will note that the specified conditions include to qualify this modified self-assessment requirement, the mechanical devices used to store, dispense, and distribute drugs must be from the same manufacturer and controlled by the same software on a single system and must operate under the same policies and procedures. Members, this is the committee's recommendation and serves as a motion and second. Are there any members that want to provide comments or have any questions to this? I can't see everyone, so if someone helps me to see if there's a hand up.
Hey, Maria, it's Jessie.
Okay.
I just want to thank you for making this so clear and easy. And I think the language that you've all come up with is very concise and makes a lot of sense. So for as someone who's not in a hospital, I really appreciate all your hard work in making this very easy for us and easy to understand.
Thank you. Any other member comments? Seeing none, let's go to public comment.
Thank you. This is the moderator, and I am opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. Or you may simply raise your hand. We're displaying instructions, and we'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
President O, it looks like we're ready for the vote.
President O, you're muted as well.
Thank you. This double muted situations make it always tricky. 2 buttons, sorry. All right, we're ready for a vote. Thank you. Chair Serpa, how do you vote?
Yes.
Thank you. Jig, how do you vote?
Yes.
Thank you, Jig. Indira, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. Kula, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you. Nicole, how do you vote?
Yes.
Thank you. Jason, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Back to you, Chair Serpa.
Thank you. Item B is discussion and consideration of the proposed revisions to frequently asked questions related to automated drug delivery systems. Members, also related to ADDSs is consideration of updated FAQs. As a part of our July 2021 board meeting, the board approved draft FAQs related to ADDSs. To ensure that the board's FAQs remain relevant, updates are necessary when changes in the law occur. Attachment 2 includes a copy of the proposed FAQs. As a committee, we determined that the updates are appropriate. And as stated during the committee meeting, I would like to thank Supervising Inspector Janice Dang, Ms. Smiley, and Ann Sodergren for their work in updating these FAQs. I believe our licensees will benefit greatly from the board's educational efforts included in the FAQs. As included in the meeting materials and submitted under this slide, let's see, do we have the right, there it is. The committee recommends the approval of the proposed revisions to the FAQs. This serves as a motion and second. Are there any members that have any comments or questions? Unless I missed anybody, seeing none, let's go to public comment.
Thank you. This is the moderator, and I have opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand. We'll give you a moment. Oh, and I see we do have a request for comment from Rita Maria. Rita, you should be able to unmute yourself. And Rita, you're unmuted.
Thank you. Can you hear me?
Yes. Oh, it looks like she muted herself again. Rita, you should be able to unmute yourself. There you go.
Okay, great. Thank you so much. Good afternoon, members of the board. My name is Rita Maria Alajajian, and I'm a pharmacist from Cedars-Sinai Health System. In addition to the written comments that we submitted, I would like to provide public comment on the ADDS FAQ for consideration. For question number 6, regarding the reporting of medication errors to the board, the current language in BPC 4125A require pharmacies to establish quality assurance programs to document medication errors attributable in whole or in part to the pharmacy staff. As such, it would be important for the examples provided in the FAQ to be attributable to medication errors made by pharmacy staff. The following error examples in the FAQ are associated with retrieval of medications by nurses, physicians, and individuals who can review medications for administration per their scope of practice. So a drug removed from the ADDS, that is the raw drug strength quantity, the nurse removes the wrong drug from the ADDS, and an ADDS with an open matrix configuration, and the nurse selects the wrong drug. Additionally, these types of errors are already routinely evaluated for adverse drug events by organizations required by CDPH and other accrediting agencies like the Joint Commission. We recommend for the board to consider removing the medication error examples in the FAQ that are not attributable to the pharmacy as specified earlier to prevent undue burden for the PIC. For question number 13 regarding monthly review of ADDS by a pharmacist, requiring a pharmacist to perform monthly review of every ADDS, especially in a hospital that has several hundreds of ADDS machines, would really prevent them from performing clinical and patient care activities. We recommend the board to add language to include pharmacy intern and pharmacy technician under supervision of a pharmacist to review these ADDS on a monthly basis. The amended language would be in alignment with the current languages in BPC 4427.4E and HSC 1261.6G, which permit technicians and interns to stock medications and ADDS, as well as BPC 4115H3, which allows technicians and interns under supervision of a pharmacist to perform monthly checks of drug supplies stored in the ADDS. Thank you, board members, for your time and consideration.
Thank you for your questions. Anne and Eileen, just to be clear, is it okay to respond?
Hi, yeah, this is Eileen. If the public comment, adds to your discussion, you can feel free to both answer or to also elaborate for the board members.
Great, thank you. I just wanted to be clear. So I do appreciate those comments. On number 6, I think the issue is really down to that the medications that are in the AUDS still are part of the pharmacy's, under the pharmacy's control. They still are part of the pharmacy's inventory. For example, during inventory reconciliation for controlled substances, it's included in the count of what is in the pharmacy's inventory, quote unquote. So the medication being in a AUDS is still under the pharmacy's inventory, so they would be responsible for anyone who has access to a medication and removes it in error. So your example is, very detailed, and I'm not sure if all the board members understand about the different technology and having a matrix system, but a matrix system is the least secure drawer. So it allows the nurse to have access to up to 42 different medications, essentially like a shelf, versus having a one dose or one pill or one medication at a time. So I think that I don't see that we could be making any changes to number 6, but I'd like to hear more from board members and the public if my explanation doesn't make sense. On item number 13, it's mostly a question for Anne and for Eileen. The commenter makes a good point. According to Title 22, which CDPH regulates the monthly inspections of pharmacies, of medications by pharmacy in acute care settings and other settings, it's under the auspices of a pharmacist being responsible, but others are allowed to perform it under the supervision of a pharmacist. Wouldn't that be the same here in question number 13? Just checking to see that it doesn't have to be specifically done by the pharmacist, but the pharmacist or somebody working under their supervision. Okay. It may require a little bit more discussion with Eileen. She might not be as familiar with Title 22 as she is with Board of Pharmacy regulations.
And that's correct. Dr. Serpa, this is Eileen. I'd have to look at that to see whether or not, and I'd want to have a discussion with staff offhand with that, unless Anne's got some greater knowledge of those steps.
I think I'd would, if possible, like the opportunity to consider it a little bit more with council before we provide a definitive response.
So I think going forward, because looking at the medications within an ADUS versus the medications that are in a drawer right next to the ADUS, they should have the same requirements for oversight by a pharmacist and not have differing requirements. So how do we go forward if we wanted to make a change or do an evaluation without holding up the FAQs? Is there a easy process, or are we stuck in having to just put it on hold?
Hi, this is Eileen. I don't really see a process since we usually have the board approve, any changes to the Faqs. And here we'd be talking about making, some substantial changes depending on what that is. I don't know whether Ann's had any type of prior experience with doing something slightly differently.
Sorry, I'm apparently extremely slow on the mute and unmute today, so I apologize for that. I think that one of the possible options that we could consider doing, if members believe that the rest of the information is appropriate to get out, it's possible that the board could consider releasing the updated FAQs with the exception of question 13 and allowing staff to evaluate that with our council and report back to the committee chair. If the board wants to delegate to the committee chair the approval to finalize the FAQs based on the legal research, that's another possible way to continue moving the FAQs forward and ensuring that the information is available while also giving staff the time to do a little bit more review of this comment.
Great, thank you. So let's continue on with the process for right now. Are there any additional public comment?
Yes, there are. We have a request for comment from Karen Yumbi. And Karen, you should be able to unmute yourself.
From Cedars-Sinai Health System. Just wanted to talk a little bit about question number 6 again. Definitely agree that the inventory that's in the AUDS is still part of the pharmacy inventory, and as such, the PIC should be responsible for that inventory. I think that I would just like to recommend looking at the quality assurance process as a means to follow up on any errors related to nursing or clinicians removing the incorrect drugs from the AUDS. The quality assurance process, as you all aware, can take up to a couple of days and requires pulling the different individuals involved in the error into a mini RCA, which if we were to do that for any and all nursing or clinician errors, the PIC would probably be stuck just doing quality assurance reviews on a daily basis. So we'd like to recommend that we in the FAQs, we look at different processes besides the quality assurance process that will still ensure that the PIC is responsible in reviewing those types of errors and following up on them without being overly burdened with the quality assurance paperwork and overall process. Thank you so much.
Thank you for your comments. And I guess, again, I just like to comment is that the FAQs are just that. They're frequently asked questions regarding regulations. We're not at this time looking at changing regulations or requirements, and the current regulations require that any medication error that reaches the patient go through the whole QA process. So the answer I have for that. Are there any other public comment?
There are not. Would you like me to go ahead and close the Q&A panel?
Thank you. I think we need to come back to member comment relating to number 13. I wanted to hear from the board members, their thoughts about the entire document, if anything else has come up, but specifically on item number 13.
Chair Serpa, if I may, I apologize again for the interruption. So I think that if it's helpful for members, I think the relevant section of the law related to question 13 is Business and Professions Code 4427.65, and then it's 7, where it does state that a pharmacist shall conduct the review on a monthly basis. So that may be where there's a little bit of the conflict. I totally defer to members and council. I just wanted to highlight the legal section, just should that be helpful for members in their consideration.
Thank you, and that kind of muddies the water a little bit more.
Because that means the intern can do that. I don't want to complicate any further, but because anything pharmacists can do can be done by intern, right? So anyway, I will not say further. It just gets complicated here.
I think it's going to be very complicated. So unless there's other members that would like to speak, my suggestion is that can I make a motion to amend the committee's motion? Would that be appropriate?
Sure.
So the committee's motion is to accept the FAQs as written. Oh, somebody speaking?
But the committee made it. I think, you know, technically we should vote it down if you want to make a new motion, and then first vote down what the committee's rec was, you know, to approve the facts as submitted.
Okay. Hearing that we need to vote on the current motion, President, I turn it to you for the vote.
Thank you. We're voting on committee recommended motion for this vote. So starting with Maria.
No.
Thank you. Jig.
No.
Thank you. Indira. Indira. Oh, okay. I think she's popped off. Jesse?
Yes.
Oh, you're voting yes? Okay. All right. Jose?
No.
Okay. Kula?
No.
Thank you. Ricardo?
No.
Thank you. Nicole?
No.
Thank you. Jason?
No.
Thank you. And I vote no. So the motion fails, and we're going to bring back the discussion to you again, Maria.
Thank you, board, and I appreciate your patience on this, what we thought was a nice, easy discussion. So I have another motion to make if appropriate, and I get a second. Is that to move forward with the FAQs as proposed, with the exception of question number 13, that be removed from the FAQs and added to a discussion of the committee in the future.
I'll second that, Maria.
Oh.
I'll let was it Jig that?
Yeah, that was me. Either one is fine.
You could have it. Go ahead.
Okay. Thank you.
So, sorry. We have a motion and a second. President O, it looks, actually, we have a motion and a second. Are there any more, more board discussion? Seeing none, we are ready for public comment.
Thank you. This is a moderator. I'm opening up the Q&A panel. If anyone would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We are displaying instructions, and we'll give you a moment. All right, I see no requests for comment at this time. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
President O, having a motion and second, I think we're ready for the vote.
Thank you, Chair Sherpa. How do you vote?
Yes.
Thank you, Jig. How do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. Kula, how do you vote?
Yes.
Thank you. Ricardo, how do you vote?
Yes.
Thank you. Nicole, how do you vote?
Yes.
Thank you. Jason, how do you vote?
Yes.
Thank you. And I vote yes. The motion passes. Back to you.
Thank you. Item C is presentation and discussion on board's inspection program. During our committee meeting last week, members received an update on the board's inspection program from the board's Chief of Enforcement, Julie Ansell. The presentation slides are included in attachment 3 of the meeting materials. I'd like to state my appreciation for the staff for their efforts towards meeting the board's strategic objective related to routine inspections. As I shared last week, I am pleased that the data shows that pharmacies with no inspections or no inspections since 2013 has dropped from 2,080 pharmacies 2 years ago to 463 this year. It appears that the issue may be completely addressed within this fiscal year. I'd like to remind board members that this goal was established. The board did not secure any additional resources. Rather, these inspections are being completed in addition to the current workload of the inspection process. I do remain concerned that we continue to have issues with pharmacist consultation not being provided to patients. This issue has been talked about in a couple of other committees also. Members, do you have any questions or comments? Okay, seeing none, let's go to public comment.
Thank you. This is the moderator, and I have opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or simply raise your hand. We will give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Great, thank you.
You're welcome.
Next item is D, presentation and discussion on board's citation and fine program. Last week, we received an annual presentation on the board citation and fine program. The slides are included in attachment 4 of the meeting materials. Some of the information provided involve pending matters. The committee avoided asking case-specific information. However, we were advised that the board has issued 2 fines pursuant to the new fine authority established in BPC Code 4317.5. Consistent with the board's strategic objective, I would assume that the common violations will be used as educational materials. Members, do you have any questions or comments? Okay. Seeing none, let's go to public comment.
Thank you. This is the moderator, and I have opened up the Q&A panel. We are displaying instructions. You may type in a request for comment or raise your hand. We'll give you a moment. And we do have a request for comment from John Gray. John, you should be able to unmute yourself.
Hi, good morning or good afternoon. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. I'd like to express our concerns about the frequency with which pharmacies and pharmacists are issued citations and fines related to medication errors. As highlighted in the executive officer's presentation, medication errors were the most frequently cited violations for both pharmacies and pharmacists. The executive officer's presentation states that the board uses its authority to issue citations to deal with important violations that warrant the licensee's attention, thought, and correction. Furthermore, Section 1775.2 of the California Code of Regulations specifies that when assessing an administrative fine, the good or bad faith of the cited person or entity should be considered. Without delving into details of specific cases, I know of cases in which I believe a pharmacist who was acting in good faith was issued a citation and fine by this board. Based on my experience speaking with pharmacists who have been issued citations and fines, it tends to be a very distressing and demoralizing experience rather than one that is likely to lead to the kind of attention, thought, and correction that the board is trying to encourage. The full board, as well as the Medication Error and Workforce Ad Hoc Committee, have expressed concerns about pharmacists' well-being, particularly workplace stress and burnout. It would be interesting to know to what extent issuing punitive citations and fines to pharmacists who are involved in medication errors contributes to workplace stress and burnout. To err is human. The Institute of Medicine's seminal report on safety in the healthcare system concluded, we cannot punish our way to a safer medication practices because it could have a chilling effect on patient safety improvement efforts. Additionally, this board's approach is also counter to the principles of just culture, which were discussed with ISMP at the January 2022 Medication Error and Workforce Ad Hoc Committee. The board's current enforcement approach for medication errors seems antithetical to these well-established views. Because of the potential chilling effect that the board's current enforcement approach for medication errors is likely to have, we believe it will be ineffective in advancing the board's mandate to protect the health, safety, and welfare of the people of California. Therefore, we recommend that either the Enforcement Committee, the Medication Error and Workforce Ad Hoc Committee, or both committees agendize a discussion on the board's current approach to issuing citations and fines for medication errors and whether Californians would be better served if the board were to adopt a just culture approach to investigating medication errors. Thank you very much for the opportunity to provide comments.
Thank you. You do make some excellent comments, and those have been discussed in public meetings and also within the staff. But I think that Anne would probably be the best to discuss some of the things that she talked about during our committee's presentation about how the citation and fine process is used, and that it's not meant to be a punitive event. But we do hear anecdotal information from people who feel that they were unjustly fined, but what you don't hear is all the other examples, and that's because the specifics of the citation and fine process is confidential. So what we hear is sometimes the people who speak the loudest, not necessarily the vast majority, who oftentimes don't get a fine. I think that's one of the things that Anne can speak to also, is sometimes it's a note and there is no monetary fine. Anne, do you have a few minutes?
Sure. I think what I'll probably keep my comments relatively brief. The board has for a number of years had its annual presentation on the citation and fine program. Citations themselves are public information, but the board does not post them. I think that when we look at some of the changes that the board sought several years ago, including the use of an order of abatement, medication error violations are actually one of those where the board really strongly encourages and issues orders of abatement, encouraging pharmacists to actually seek some additional education and or training in things such as medication error reduction strategies. If it was an error related to maybe pediatric medication, sometimes it's a recommendation to complete some additional education there. I will say that when issuing a citation, it is done on a case-by-case basis, and board staff review the totality of the circumstance. So we try to take into account all of the various factors involved, including whether or not it was a system issue or what some of those contributing factors would be, and try to provide a meaningful response to that. In terms of transparency to the process, I did indicate that citations are public information once they are closed, and board leadership does receive copies of those closed citations for their review.
Thank you. Are there any other public comments?
There are not.
I see his hand is raised.
Just a moment. Let's finish with public comment.
No more.
Ricardo, is that specifically to this person's question, or do you have?
No, I just I had a comment in general, but we're in public discussion right now.
Okay, yeah, I'll come back to that. Thank you. All right, I'm sorry, Tricia, did you say, do we have any other public comment?
We do not. Would you like me to close the Q&A panel?
Please do.
Okay.
Since we did have a interesting question from the public, I'll open it back up to the board members if they wanted to ask any questions or comments.
Yeah, I just wanted to say that, you know, being on this board for 8 years, the majority of our cases, they're administrative. You know, it's very rare that they go criminal. And we have the ability to do both of those. And we're very fair on this board. I don't know, that's just my observation, and I'm basing that on the citations that are issued and the actual, whether we have any criminal action that is actually filed with some of the cases. You could also make the case that we're very lenient. But I think the licensee, the majority of time, you know, they get handled in an administrative fashion as opposed to criminal. So there's two sides to it. Just want to point that out.
Any other board member comment?
You may not be able to see a hand raised. This is member Koenig. I you know, even when we were talking earlier about the ratios, and I had a thought, and this kind of brought this back. One of the key things we've always been talking about is just workforce and how many people we have, how burdened they are, all the things that they have to do, and how that relates to medication error. And, you know, the comments about just culture really just sparked in me that, and I don't know if the medication error committee is something that we can talk more about, but it is to the extent of what is the current system that we have in place that is creating medication error, and then how are we not punishing, but yeah, I guess punishing folks that make these errors because of things that are like we've already trying to work on, like workforce, right? So I just wanted to uplift that because I think the comment was a valid one.
Mm-hmm. Yeah, everyone's making really good points. I think one of the things to consider, as Anne is talking about, is all of those issues are considered with the individual. Every case is individual. There's no two cases that are alike. And I would encourage board members to listen to Anne's presentation. It was very complete and it is recorded and available to view. You can see the information in detail. And if you have further questions about the citation and fine program, I think we do have opportunity to talk about it again, either in committee, or if you just had a specific question, I'm sure you could reach out to board staff about how the process works. Anne or any other board members, do you have any other comments?
Hey Maria, this is Desi. I do have a comment too. I agree with Kula's comment, and I'm wondering if there's an opportunity. I know we touched upon it at the last medication error committee meeting, but I wonder if we can have a full discussion or presentation maybe on just culture from ISMP or maybe another organization, just to provide us with some more in-depth information on what that looks like. And I do want to note too that I think an issue in some workplaces is the culture of medication error reporting. I think it varies drastically between workplaces, and it sounds like there may be better medication error reporting in hospital settings versus chain pharmacy settings, and I know each one is a little different. And I know that is part of the self-assessment for community pharmacy. There is a portion dedicated to medication error, but I'm wondering how thorough of a job pharmacists are actually doing, evaluating that when they become new PICs at a community setting. But I think it's a really good point to bring up, and I appreciate all the information that you're providing us.
Yeah, you make an excellent point, and I think that would be a wonderful presentation to have a next level at the medication error reporting committee, if that is something that they can add to the agenda. Any other comments? Okay, thank you. Going on to item number E, discussion and consideration of community pharmacy staff requirements, including Business and Professions Code 4113.5 and Title 16, California Code of Regulations 1714.3. The meeting materials detail the relevant sections of pharmacy law. BPC Section 4113.5 provides that a pharmacist shall not be required to engage in the practice of pharmacy unless another employee of the pharmacy or employee of the establishment is made available to assist the pharmacist at all times. The board's regulation details the requirements pharmacies must meet to satisfy the requirements of the statute. As these are investigations pending in this area, I request that members, staff, and the public keep the comments general in nature to assure members avoid any inadvertent exposure of information that would preclude members from involving in the role of our decision-making in the enforcement matters that are pending. Materials detailed out the implementation strategy used by staff, where staff initially focused efforts on education of their requirements. Staff efforts transitioned to issuing orders of correction to gain compliance. However, after a significant period of time to allow pharmacies to comply with the provisions, depending on the egregiousness of the violation, staff have determined the appropriate outcomes. To date, the board has issued 2 citations for violations of these provisions. As I stated earlier, investigations are currently pending, so we can't talk about those details. There appears to be a misunderstanding by some about the requirements of the statute, as well as frustration by some pharmacists who are not requesting assistance at their workplace because they believe that such assistance would not be made available even if they were to ask. During the meeting, members were reminded of information recently released for pharmacy personnel describing on how to file a complaint with the board and some information on whistleblower protections. Although the information was related to implementation of another measure, both the process and protections are the same. Public comment during the meeting suggested that the board should provide more education on the requirements as a possible means to address the misunderstanding of the law. It was also suggested that the board should develop what I understand to be a more interactive online complaint process that would walk the individual through the filing process online. The commenter also encouraged the board to use its higher fine authority when violations to the provisions are substantiated. Members, do you have any comments or questions?
Hey, Maria, this is Jessie. I think this kind of ties to a little bit of our discussion earlier about the minimum staffing requirement in general. And I know that I think there was a public comment about potentially having a minimum of one pharmacist to one technician. So I think that that could be tied together, but I think we'll kind of have to see how these pending cases go once we have more information about the outcomes of those. I think we'll be able to better assess this.
Thank you. Any other member comment? Okay, let's go on to public comment.
All right, this is a moderator. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or you may simply raise your hand or display instructions and we'll give you a moment. All right, I see no request for comment at this time. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
The last item on the agenda for my committee is review and discussion of enforcement statistics. Attachment 5 includes the year-end and 3-year statistics for the board's enforcement relative activities. Members, there's a lot of data here provided. Do you have any comments or questions on the information? I don't see anybody. Did I miss anybody? Let's go to public comment.
All right, this is moderator. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
President O, that concludes the report of the Enforcement and Compounding Committee. I turn the meeting back to you.
Thank you, Chair Serpa. Thank you, everyone. So we're now moving on to agenda item 12, closed session. But obviously we will take a lunch first and we'll convene in closed session. So I'd like to thank members of the public for your participation today. As indicated on the agenda, the board will convene in closed session at 1 p.m. Hopefully that's sufficient time for everyone to take lunch. Adjournment for the day will immediately follow closed session, and there will be no other items of business discussed. Members of the public, thank you for joining the meeting today. We will reconvene tomorrow morning at 9 a.m. Members, we will begin closed session at 1 p.m. Please join the meeting via the information sent by Debbie Damas, and we will see you at the closed session. Have a good day, everyone.